Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Andhra Pradesh, India. I am also the medical author of the book Focused Neurology. Today we are going to talk about a very interesting topic which will interest perhaps to all the sections of population, especially the youngsters. The weight loss and obesity, the BMI and the role of brain in the regulation of weight. So weight loss and obesity, everybody will be interested because everybody wants to have a normal or perhaps even a less than normal weight. Having less weight actually is good. First of all, it may increase your self-confidence. It may boost up your confidence because you look attractive. But second important point is that when we weigh less, normal or less than normal weight, lot of complications can be prevented. If we have normal or less than normal weight, ideal weight, we can avoid diabetes mellitus, hypertension, the insulin resistance, and obesity is also risk factor. Weight, they are risk factors for vascular disorders, atherosclerosis, and can cause stroke, myocardial infarction, can cause joint problems, osteoarthritis, and some cancers. So maintaining an ideal body weight is good for all reasons. It could be for cosmetic purposes, it could be for medical purposes. So how do we maintain normal weight and how does brain regulate weight? This is going to be the point of our discussion today. The weight, the normal weight is maintained as a balance between two forces. One, the intake. Second, the energy expenditure. The intake is directly related to your diet. Obviously, the more we eat, the more weight we put on. Energy expenditure. The less we eat and more we exercise, obviously our weight is going to come down. So it's a balance between the energy, the energy gain and energy expenditure. A balance between the energy gain and energy expenditure. So we'll now discuss how we can maintain a normal body weight by increasing energy expenditure and decreasing energy intake. Right, but what is the role of brain in maintaining weight? Basically, there are three hormones. One, the ghrelin on one side. Second, the leptin and insulin on the other side. The leptin and the insulin are the hormones which inform brain of the fullness of the stomach and leads to satiety. So brain thinks that we've had enough, now we'll stop eating, and therefore the eating comes down and obviously the weight comes down. On the other hand, at the other end of the spectrum, we have ghrelin, which gets released when there's an empty stomach, a lot of noise is going on the stomach, ghrelin releases. This informs the brain that we are deficient and it stimulates the hunger center in the hypothalamus and we start eating. So brain plays a very important role in regulating weight. So with this basic introduction, now let's see all the important fascinating concepts of weight loss, obesity, BMI, and the central role of brain and hypothalamus in regulation of weight. Weight loss, obesity, BMI, and brain. First, we need to understand few definitions. What is adipose tissue? Adipose tissue is a tissue which contains fat cells which stores triglycerides as energy and releases as free fatty acids when required. So basically it is a storehouse of energy in the form of triglycerides. That is adipose tissue. So when do we call persons as obese or obesity? What is obesity? Obesity is a state of excess of adipose tissue. Obesity is an excess state of excess adipose tissue mass. We have a very important way, a simple way of gauging and rating obesity, whether the person is maintaining ideal weight or less than normal weight, obese or morbidly obese. We call that method as body mass index or BMI. Body mass index is a method to gauge obesity. We take the height, we take the weight in kgs as the numerator and height in square meters as the denominator. So kg by height in meter square is the body mass index. So we get various values in the body mass index. Depending upon this body mass index numerical values, we say at the one end of the spectrum that the person is underweight, or at the other end of the spectrum person is overweight or obese. So what are all the numerical values and how does our treatment depend on these values? First, when the body mass index is less than 18, when the body mass index is less than 18, we call them as underweight. When the body mass index is between 18 to 25, we call them as having a normal weight. So 18 to 25 is the ideal weight. When the body mass index is between 18 and 25, it is the ideal weight of that person. But when the body index exceeds 25 and it is below 30, we call that as overweight. So when do we call person as overweight? When the body mass index is between 25 to 30. So this is the first stage where we need to intervene to reduce the weight. So here we need not go for pharmacological therapy or surgical therapy. The lifestyle management is enough for a person who is overweight. That is body mass index between 25 and 30. There are three ways of changing the lifestyle of the person, the lifestyle management. The three ways. One, diet. Second, exercise. Third is the cognitive behavioral therapy. Diet, exercise, cognitive behavioral therapy. Diet, we ask the persons obviously to take less diet, less food. The food especially to be avoided are carbohydrates and fats. So fats has to be avoided. So we ask the persons to take less food, less of fats and less of carbohydrates. So diet is very, very important in weight reduction. Diet is more important than exercise in weight reduction. For weight reduction, we have to reduce the food intake. Only to maintain or sustain the lost weight do we ask the persons to exercise. So exercise, though important, plays a secondary role as compared to diet. So diet is going to be the fundamental way, reduced food intake is going to be the fundamental way to reduce weight. Exercise is to maintain or sustain the weight which is lost. So we ask them to take less food containing less of fat and less carbohydrates. Exercise. According to the American Heart Association, the Stroke Association, 150 minutes of exercise, moderate intensity exercise is required per week to maintain or sustain lost weight. 150 minutes per week. So if we do 30 minutes of brisk walking just 5 days a week, that is sufficient according to the Heart and the Stroke Associations. So we ask persons to have at least 150 minutes of brisk walking a week. That is 5 days a week. 5 into 30 is 150 minutes. So the American Heart Association recommends 150 minutes of moderate intensity exercise. That is, brisk walking itself is sufficient. So that's very, very important. Diet is to reduce, less diet, taking less food is to reduce weight. Exercise is to maintain the lost weight. The third important way to reduce weight is cognitive behavioral therapy. Here we ask them to change their behavior. When he takes food, we ask them to take it in small plates. Serve the food in small plates so that he takes less food. Ask the person to drink a lot of water. The stomach gets the feeling of fullness, and the leptin and insulin hormones may release because of fullness. Though leptin and insulin hormones are basically released because of high glucose levels and high lipid levels, the fullness of the stomach itself will stimulate the satiety center in the hypothalamus. So ask them to drink a lot of water. Ask them to take fiber-rich food, because fiber will absorb water and cause fullness of the stomach. So basically the behavioral therapy indicates ways to trick the brain to think that there's a lot of food in the stomach, but it's not food, it's water or fibers which absorb water, causing the fullness of the stomach. Third, what we do is that when we get bored or we watch TV serials, we start eating food. You must have seen a lot of youngsters when they watch cricket match, international cricket matches going. They sit together, either the family members or friends sit together. As they watch the cricket match going on, they keep eating chips, popcorn or whatnot, fast foods. This will cause them to put on weight, overweight. So the cognitive behavioral therapy indicates that they have to take food in small plates, take a lot of water and fiber so that the stomach gets full and the brain is cheated to think that there's a lot of food in the stomach and the satiety center is stimulated. Third, when we watch television or when we get bored, we have a tendency to take a lot of food. So that we have to avoid. So these are the simple, easy ways to reduce weight instead of taking pharmacological drugs or surgery. So basic easy ways to reduce weight is diet. Take less of fatty foods and carbohydrates, especially avoid fast food, fried foods. Exercise, just 30 minutes of brisk walking every day, and that to 5 days a week, amounting to 150 minutes per week. Not eating food unnecessarily when you're not hungry, like watching TV or when you get bored. Avoid these things. These measures are sufficient when you're overweight. That is, the body mass index is between 25 and 30. But once the body index goes beyond 30 but less than 40, we need to start giving drugs, pharmacological management. We can give phentermine topiramate combination or lorcaserin, liraglutide, or the combination of naltrexone and bupropion. These are the pharmacological drugs. But when it goes beyond 40, what we call that morbid obesity, beyond 40, the BMI, body mass index, we have to surgically intervene. So basically, the satiety center has to be stimulated. That means the stomach, the brain should get the feeling as if the stomach is full, or we should not allow food to get into the stomach, either by reducing food intake or by making measures not allowing the food to enter into the stomach. So surgical methods will include banding techniques, the gastric banding. Through endoscope, we can put a band around the stomach so that less food enters into the stomach. Or we can do sleeve gastrectomy, take a small layer of stomach, cut it, especially the greater curvature of the stomach, so that the food which can be taken in the stomach will be less, or gastric bypass surgeries. So whatever the method may be, we are trying to allow less food into the stomach so that the person does not unduly gain weight. So these are all the surgical procedures. So less than 18 is underweight, 18 to 25 is the normal weight, 25 to 30 is just lifestyle measures changing, less diet, exercise of 150 per minute, cognitive behavioral therapy. 30 to 40% is obese, we give pharmacological therapy. Beyond 40, it is surgical therapy. Right. The fat getting accumulated, the site also plays an important role as the fat gets accumulated. Not all the sites are equally dangerous. Some sites are more dangerous than the other sites. So we have two body shapes when the fat gets accumulated. Fatty shaped bodies are two types. One is the apple shaped body. Second, what we call is pear shaped body. Apple shaped body is more common in man. The obesity is more above the waist, that is in the abdomen. You would have seen a lot of men having obesity, having fat accumulation, but more in the abdomen. That we call it as an apple shaped. Second, the fat can accumulate on the thighs or the back, the posterior, especially for women. We call that as pear shaped. So it is below the waist. So women have got a tendency to accommodate fat below the waist. We call that as pear shaped, which is less dangerous. Males have got a tendency to accumulate fat above the waist, that is in the abdomen. We call that as apple shaped, that is more dangerous. Why is it more dangerous? The fat above the waist is more dangerous than the fat below the waist. So if you see the waist by hip ratio, obviously will be more in man, and waist by hip ratio will be less in women, because the fat is getting accumulated above the waist in man. So you have to always check out on the waist to hip ratio. Why abdominal fat or the apple shaped fat is more dangerous? Because the free fatty acids which are present in the abdomen, they enter into the portal circulation. Abdominal fat, they enter into the portal circulation and cause adverse metabolic actions, especially on the liver. The abdominal fat enters into the portal circulation easily because it is close to the portal circulatory system. So enters the portal circulatory system and causes adverse actions on metabolic actions, especially on the liver. That's why it's more dangerous, apple shaped body. The complications are insulin resistance, diabetes, hypertension, hyperlipidemia, and hyperandrogenism in women. So hypertension, diabetes, insulin resistance, all these also cause atherosclerosis, increase in myocardial infarction, increase in stroke. So apple shaped body, abdominal obesity is more dangerous. So we have to really tackle that. Right. Now let's see the role of brain in controlling weight. So brain plays a very important role in controlling weight. To understand that, we need to know blood-brain barrier. There's a barrier between the blood vessel and the brain, tight endothelial junctions. So they will not allow substances to come from the intravascular compartment to the brain because of tight endothelial junctions. So if that were to be there in all areas, even in hypothalamus, then hypothalamus cannot perceive these substances, ghrelin or leptin or insulin. So in the hypothalamus, the blood-brain barrier is not complete, is deficient. We call that as a leaky blood-brain barrier. So Mother Nature has wonderfully created an incomplete blood-brain barrier, a leaky blood-brain barrier in the hypothalamus, so as to make the hypothalamus perceive the hunger hormone ghrelin or the satiety hormone insulin or leptin. So the first concept is that the hypothalamus has got a leaky blood-brain barrier. Hypothalamus has got two areas, one the hunger area, second the satiety area. The hunger center gets stimulated when we are hungry, that means when the stomach is empty. So the vagus nerve gets stimulated. It carries a hormone known as ghrelin. Ghrelin is carried by the vagus nerve when we are hungry. It stimulates the brainstem and the hypothalamus, the hunger center, which makes us to eat. So that's why when we are hungry, we feel pain. The ghrelin gets released, taken via the vagus nerve to the brainstem, to the hypothalamus. We feel hunger pains. We take food and then the hunger subsides. This is when we are hungry. But when we are full, when we have taken good food, when we are full, the stomach is full, gut peptides, leptin, especially when the lipids are released, insulin when the glucose is released, these hormones goes and stimulate the satiety center of the hypothalamus, and therefore brain realizes that our stomachs are full, and therefore it will not allow the person to start eating. So it will make the person to stop eating. So ghrelin will make the persons to start eating. Leptin and insulin will make the person to stop eating. So the more the leptin, the better it is in terms of controlling the weight, because it is a satiety. It produces satiety by stimulating the satiety center in the hypothalamus. So the more leptin, the less we eat. So what is the pathophysiology of obesity? So obesity, as I said, the more the leptin, the less we eat. So the less the leptin, the more we eat. So the basic pathogenesis of obesity is less of leptin. So they keep on eating. The less of leptin could be because of genetic factors, because of the mutations in the leptin or downstream leptin metabolites, or dietary factors. By eating a lot of fatty food, it can cause inflammation and can produce leptin resistance, so that the brain thinks that there's a less of leptin and we start eating more. So basically the pathophysiology of obesity is because of decreased leptin and increased food intake. So this is how the brain regulates weight. So everyone is desirous of having a normal body weight, one for cosmetic purposes or second for health reasons. People start hitting the gym or working out, exercise, running, walking in any form. So basically how we maintain normal weight is decrease food intake. That is the most important part, because it decreases body weight. And to maintain the decreased body weight, sustained body weight, we have to exercise. Just moderate intensity exercise, that is brisk walking of 150 minutes, that is 5 days a week, that itself is sufficient for us to maintain a normal weight. Hope you have listened this lecture and enjoyed well, and I hope you decrease your food intake and walk a lot and work out in gym and maintain a normal weight for cosmetic reasons and for health reasons. If you have liked this lecture, please like and subscribe my YouTube channel Dr. Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts, and your suggestions and comments are welcome. Thank you. Bye.